So as I mentioned, I think I do a lot of monitoring and diagnostics for the U.S. So some resources to get you started. If you're going to be doing it in your own area, I highly recommend the website EEHV Info. We've got documents on monitoring Asian elephants and African elephants. In addition to the European document, what they do in Europe. We have facility-specific documents from several zoos in the U.S., as well as ZSL and BIAZA. We have a standards of care for elephant calves, so it goes into a lot of the training that would be necessary to do this monitoring. There are videos on trunk wash collections from Houston Zoo and Paul's lab. There's the EEHV Asia brochure, which I think Lauren has copies of to give out this week. And then there's documents on clinical findings and treatment, and Lauren's going to be talking about treatment. So when we talk about diagnostics, what are we doing? If you have a live animal that's sick, the only sample that's good right now is blood. You can't do diagnostics with the trunk wash. You have to have blood. You're going to be doing conventional or qPCR. qPCR is ideal if you can do it because that's going to give you the viral levels. But if you don't have access to that, it is a little bit more expensive, a little bit more training involved. qPCR is good, especially if you can do 2 rounds of it. It will be as sensitive as the qPCR. And you can detect the virus in the blood for up to a month ahead of time. So that's why we really recommend, if you can do weekly monitoring, you're going to get a heads up on what's going on. And it'll give you a chance to do the early aggressive treatment that has been very successful. It's not always a month ahead of time that we see it. It does happen that you'll go from undetectable, barely detectable, to hemorrhagic disease in less than a week. But usually, weekly monitoring is pretty good. If it's postmortem, you're going to want to take tissues, take photos of any lesions, formalin fixed tissues for histopath, and then tissues either frozen or like an ethanol or a DNA preservative will be good. And you're going to be doing PCR also. If you're looking for prevalence in your population, you can use trunk washes. You're going to be looking for shedding in the trunk wash. You can do either conventional or qPCR. And that is, again, not good to diagnose an active case. Trunk wash is not a sample. You can do swabs, but from what I've seen, it's not nearly as sensitive as a trunk wash. We do have some studies going, and swabs are much easier to get, and we do detect EHV in swabs, but just it's not as sensitive. I detect it much less in the swabs than in the trunk washes so far. So when we're talking about qPCR, we're talking about Paul Ling's assays. There are some other assays out there, but I highly recommend Paul's. It's a very solid assay, and it's the one that I use in my lab, and it's the one that when I go out and train other labs, I use. So here are the 3 references for his, and he developed assays for EHV 1 through 6, and as well as specific ones for 1A and 1B, so we can distinguish between those 2. So in an ideal world, where you've got hands-on access to well-trained calves and you can get these blood samples, you've got plenty of staff to take the samples, you've got funding for reagents, and you've got access to a testing lab. I'm going to have a few slides, how you would want to monitor. You want to test for the appropriate EHVs. You're only going to test the Asians for the Asian viruses, Africans for African. And you want to test either weekly or twice weekly. I do have several zoos, I think 4 or 5, that send samples in twice a week. And if you can do it, I think that would be ideal because we have seen a couple cases where it was within less than a week. So if you were depending on weekly, it wouldn't have been enough. But usually weekly is good. It's kind of a good standard to go by, so you're not stressing out your staff and your calves taking a lot of samples. And we used to do up to 1 through 8, 10 years old. We're now recommending up to 15 years if you can. It's a lot of samples, so we realize not everybody can do that, but we are seeing the cases in the older juveniles. So again, ideally, you're going to look at your elephants every day for behavioral changes. You're going to know baseline information on heart rate, respiration rate, fecal bolus temp, blood pressure. You want to have those individual numbers so you know what's normal for your calf. You want to do weekly CBCs, know what their platelet levels are, monthly serum chemistries, and if you can, bank EDTA and whole blood from the herd. Weekly would be great. We never know when we're going to want to go back and see something. So if you can take those samples and bank them, they're very valuable. You could end up sending your samples to Paul eventually and find out what's going on if you've got those banked. And again, ideally, if you get a positive result, you're probably going to go to daily testing from the weekly. That'll give you an idea of what the levels are, how treatment's going, and I think Lauren's going to talk more about this. You're going to be monitoring a lot of things besides the viral levels. You're going to be looking at CBC, clinical signs, white blood cells. And pretty much if you've got a calf with any level of EHV1, most likely you're going to start treating just because you don't want to wait. Definitely don't wait for clinical signs to appear with any of them. Look at the blood values, the monocytopenia, to decide on treatment or not. Don't wait for clinical signs. So rapid aggressive treatment has been shown. Ramiro Isaza looked at a bunch of previous cases, and survival really increased when treatment started before clinical signs. If you wait, I think it was like 80% mortality. Testing for serum and clotting by TEG may give you some clues to prognosis. So if you can do those, that would be great. You want to test any other calves in the herd. We definitely do see calves, in the same herd getting EHV2, so you don't want to ignore them. Test them daily. And then as the viral levels decrease, you can kind of back off on the testing. So in the real world, where you might have wild elephants or you might have elephants that are not well trained, you might have limited staff, limited funding for reagents, limited access to testing. I have a few ideas for what you can still do to monitor your elephants for EHV. So this is a brochure put out by Wildlife Reserve Singapore. It was Sonia Luz and Lauren who kind of facilitated it with input from a lot of people from the EHV Asia Working Group. And it goes into sampling, treatment, diagnosis, how to make plasma, a lot of information in there. So definitely hit Lauren up for a copy of it. And there's also copies of it on our website. So if you have calves that are not trained for blood draws, there are a couple things you can do. There's a paper put out by Javier Lopez. I think he was at Chester Zoo, I'm not sure. It's a lancet and swab method. You can get about 25 to 50 microliters of blood this way. That won't be enough to detect the low levels of viremia that we want to see ahead of time, but it will be enough to detect, a good size viremia that's going to lead to HD. And maybe that can be improved as we go along. And then there's also, if you have partially trained calves, in our new EHV Africa monitoring document, you can use an under-the-tongue sedative, I think it's called ditomidine, and maybe the calves will be a little bit more amenable to blood draws. If you don't have access to PCR testing, or even if you still do, a paper put out by Ellen Wiedner and a couple of people tells you what to look for in blood smears. What are you looking for in an inflammatory thing going on to know that you've got something going on. And if you want access to PCR testing, talk to any of us in the EHV advisory groups. We'll at least be able to give you protocols and advice, and then we can work with you if you want to get some help setting up labs. We'll work with you, figure out what we could do. We'll have to look for funding, but we're all willing to do whatever we can to help. There's a new program, the AZA Elephant Safe Program. So AZA is the Association of Zoos and Aquariums in the U.S. And they have a SAFE program, which is saving animals from extinction. And they have programs for a bunch of different endangered species. And the Asian elephant one has just been getting going. And one of their programs is to help out with EHV. So they're generating funds right now, and they're going to hope to provide famciclovir and lab capacity help to Asian elephant range countries. And I have a little bit more about it in the next talk. And then at the Thursday workshop, we're hoping to gather data on what resources everybody has and what resource gaps there are. We want to brainstorm ideas, how do we do things with wild elephants or partially trained, if you've got limited lab access, what do you do? So we're hoping to talk about that, form some communication group, Facebook or WhatsApp, to get everybody in the range countries talking to each other, form some collaborations.